I'd like to invite Dr. Antônio Carlos Bezerra. He's a consultant for the Pharmacopoeia Committee and of Medical Specialty of WHO. He worked at the National Agency for Sanitary Agency for National Medical Surveillance. He has been the general manager of inspection and control of inputs, raw materials, and medications. Between 1999 and 2011, he was a member of the working group of the Pan American Health of Harmonization of the Pharmaceutical Legislation at PAHO.
Boa tarde.
Good afternoon, everybody. I'd like to thank, first of all, ISACS for inviting me to participate at this meeting, and also the Ministry of Health of Argentina. And I'm also going to speak in Portuguese. It's always good to show that in Latin America, Portuguese is also spoken. I'm going to speak slowly so as to make the job easier for the translators. I would also like to thank the organizers for yesterday's wonderful dinner, because at those times we have a chance to network and talk to our colleagues. I talked a lot to Pedro about the history of Latin America, and also talked to people about the future. So these informal coming togethers are times to talk about the present and the future. And Pedro was surprised when I told him that the origin of this wonderful Argentinian beef is closely related to the cattle that came from Brazil going through Asunción, Paraguay. Pedro was very surprised. So when he heard this, but I think these informal encounters are a very good time to talk about the subject matter of the conferences of our work, but also to talk about issues that involve all of us, because we are peoples of Latin America. Now I'm going to talk about the Brazilian experience in the analysis of pharmaceutical patents. I'm very passionate about this issue. I know it's not easy to describe it and to cover it in full in a short time. As we said yesterday, and as the members of the panel also say today, I'm going to talk about the patent system for medications in Brazil. And I remember something said today, that our legislation was very generous. Reinaldo explained this clearly and carefully brought this information, shared this information. Our legislation was very generous because it set forth devices and approaches which were taken up by companies, by our policymakers. As examples, they mentioned the pipelines, the pipeline which would include products, different kinds of products. And at some point in time, we might wonder, how come this previous agreement come into place? Ken talked about the retroactivity. Maybe there wasn't full awareness back then. The 1995 law was implemented in 1997, and there were two waves, or two important movements in Brazil back then. One was the passing of the Generics Act and simultaneously the creation of Anvisa, the Sanitary Surveillance Agency. And this drove the development of the Brazilian pharmaceutical industry. As Reinaldo said, our market, well, the leaders in the Brazilian market are out of the leading pharmaceutical companies in Brazil. Out of 10, 5 of them are domestic companies. And this goes against the common wisdom, which says that it's usually international companies that dominate the pharmaceuticals market. Because of this, because of this scenario, an amendment to the 1996 Act on Industrial Property was introduced. Sharing the experience or bringing the experience of a health surveillance agency to deal with patents, well, this was taken, or it was said that the agency would analyze the patent applications which had been applied for. That was a challenge, and this is the experience I'd like to share with you. Considering these 13 years during which the agency, to a technical unit headquartered in Rio de Janeiro, carried out tasks related to patents.
Durante esse período, a agência...
During that term, the agency had some limitations early on. It didn't have its full legal powers to do the analysis it had to do. But in 2008, it passed what we call the RDC, a resolution which gives them some legal power. That tool made it possible to have an administrative procedure for the requests submitted by INPI to the agency for that analysis of prior consent. So those administrative procedures were put in place and the decisions related to prior consent were communicated. You can see that in 2009, General Federal Prosecutor's Office led us into the winter. Our winter has been approaching for some time now. This General Prosecutor's Office issued a resolution, a ruling that said that the agency might make a statement regarding the safety and efficacy of the medications being considered. And this opened a big question mark for the patent system, because as you know, a patent application may apply to a compound, and clinical and preclinical trials are called for. So talking about efficacy and security in the patent period is a very controversial matter.
The agency tried to find the possibility of
not approving or not implementing that ruling, but in 2010 it was ratified. That is, the agency could only manifest in matters of efficacy and security, no longer in terms of performing tests to assess patentability criteria. That created some issues that led the agency to try to find allies. And in 2011, there was an interministerial working group. The Ministry of Health, the Ministry of Development and Trade, where INPI reports to, and the General Prosecutor Office also was part, and Anvisa too. For about a year, we had certain debates, and the resolution came out in 2012. The resolution included the CGO idea, and there was a ruling similar to the previous one. That is, the agency could talk about efficacy and security. It also said that it would be important the agency taking some stance on patents. This gave us some room to create this flowchart that allowed the agency to start the assessment process. You can see that requirements come through the INPI. It arrives at Anvisa, Anvisa assesses it, and if there is a consent, it goes back to INPI for INPI to decide whether or not to grant the privilege. And if not, INPI would file the request and the patent would be denied. That's the flow chart, and that's the process devised by that resolution that is still in force. Today we get applications from INPI, and somehow we move forward. There was other things also important as the working group was doing or taking different steps. I'm going to go quickly. These actions, this legal framework, this public hearing, this this resolution, this ruling, somehow created a larger structure. And very recently, in 2014, the Ministry of Health issued a resolution that includes other aspects. This resolution number 21 was based on the decisions made by the working group. The agency can assess and analyze the requirements that arrive from INPI and consider whether this is for or against public health. There are some risks associated, and that is what to be considered, and also to consider whether the product can be considered a strategic product. We created a process. We used to analyze all applications, but this resolution led to certain guidelines. One that is relative to strategies, and that links to what Reynaldo mentioned. This is a list of strategic products for the Ministry of Health. So whatever was in the list and identified as a strategic would be products which patentability should be discussed. Here we have some administrative details. The resolution was implemented last year.
fina,
In order to implement the fine aspects of the resolution, we issued this service order that mentions the risk, and we linked this to the forbidden product. So we have a resolution issued by the ministry that is updated based on international agreements and refers to a list of products that cannot be traded. This is because we would refuse, and we've refused already, based on TRIPS that talks about policies that are against public health. This is the list of a strategic product. This is not from the agency that decides. The one that decides the public health policies is the ministry. The agency, therefore, was created by the ministry, and the agency does the follow-up. And these are the applications that we analyze. In 2013, the list was updated and expanded, including these two new categories. And now, in December 2013, 2014, the cabinet of the Ministry of Health issued this and talks about the interest of prior consent for Anvisa. It defined the scope of the list that I showed you before and created a short list that includes categories that, with information we are going to supply you. These are the categories that will be assessed for their patentability. Besides, the Ministry of Health has explicitly stated in Article 2 that products or processes that are of interest for the system should be analyzed based on the patent law criteria. That is, a strategic product should be assessed based on patent law criteria. This is a quick overview that refers to our background. It's a summary. I'm just going to show the results, the outcome. These results are before the creation of the flow chart. You can see the number of applications that were granted, the number of applications that were not accepted, and those that were rejected. This that happened in 2012 referred to a 12% of applications that were not accepted before the flow chart. That was first received by INPI to grant patents. So we can say that 12% of the applications, the agency and INPI did not agree. We do not believe 12% is a very high number, but as it was mentioned here, INPI has really updated the guidelines, and this is closer to Anvisa And now we can say that not everything is close, but they are really close to Carlos Correa's guidelines from the WHO. There's a need here to harmonize, to standardize those guidelines. This is an overview of the prior consent. These are applications separated by biotechnology, pharma, and chemical, and we can see that biotechnology requests are on the rise. We're going to show this very quickly to reach our conclusions. This is another way of showing the different and main reasons why consents were not granted. We can see different conditions here, selection issues, methods. Everything is properly described in the survey. Here, these data are more recent. I don't know if it was clear when I say reverting the flow. Until 2002, we were receiving requests analyzed by NPV. This was criticized afterwards because the idea was that Anvisa was re-examining things. Now we have reverted this, and Anvisa is the first to make an analysis of what we received. This is 2012-2014. And you can clearly see that those that were not granted prior consent, the reduction was not so big. We are still waiting for a resolution. We demand certain things. We request certain charts that can be altered. This is very important because this consent at some point in time is 20-30% of charts that are limited because of agency obligations. So this seems not to have been or not to have changed significantly. We are analyzing strategic products nowadays. So
As nossas perspectivas, né? Está
these are our perspectives, our outlook. We are moving forward with guidelines, which I believe is very important, a strategic realm for countries. I believe the decision to link health to examination agencies is important. Now we are working towards the mapping of patterns of interest, and as mentioned by Reynaldo, we have been requested by the Vice President of Fiocruz to assess the process, and this somehow is being analyzed to deliver a report to the Ministry of Health so that they can develop requirement processes or analyzes processes to see whether something will be granted a patent or not. As I said before, the consequences of this, I can mention this, but it is important to say that we negotiate a product that is so expensive like this one, Why the negotiation now if we don't know whether the patent will be granted or not in Brazil? Maybe we can request a compulsory license and then say that the patent should not be granted. So we think that this instrument that is so strict brings possibilities to consider patents that do have the merits because of the innovation they imply, and this should be embraced, not forgotten. We believe this is kind of not a new or misused instrument. Argentina mentioned this, and I think it is important because somehow it is an instrument. I have already mentioned flexibility and access. We can have more. Reinaldo showed the figures that relate to that stronger exam. I'm available for questions, if any.